Hello, everyone, and thank you for joining us at Alameda County's
Bueno,
Healthcare for
pues
the
ya empecemos, te amo.
Homeless
Vamos a reconocer, coge tiempo.
National Homeless Persons Memorial Day. And if everyone can remember to mute themselves,
Porque
please.
ya no necesitamos que nos castiguen. Te amo. Hablamos luego.
Thank you for muting yourself. My name is Aislinn Bird. I'm a psychiatrist with Alameda County Healthcare for the Homeless in the Trust Clinic. And we have a full agenda today, so we're going to get started. And thank you so much for being here. So we will start today's memorial with a song. And I'm pleased to introduce Marilyn Reynolds, who is an educator, singer, and community activist who is deeply connected to the homeless in West Oakland. Marilyn?
Good afternoon, everyone. It's my pleasure to sing for you today. I'm holding a picture of two of my friends who passed away. They were both homeless. Oh, gosh, sorry about that. You know, people always know when to call at the wrong time. Anyway, this is Ruth and Freddie Hudson. And they passed away last year. Ruth passed away in August of 2020, and Freddie passed away December of 2020. And they were both homeless, and even up until when they passed away for over 10 years. So I'm dedicating this song to them today. Swing low, sweet child, coming for to carry me, sweet low.
Marilyn, unfortunately,
Marilyn, I'm sorry,
muted.
you're unmuted. Sorry about that.
Marilyn, we can't hear you. Something happened and you got muted. Ah, there you are.
Okay, I'm starting over. Swing. Could you hear what I said about Ruth and Freddie? Okay. Swing low, sweet chariot, coming for to carry me home. Swing low, sweet chariot, coming for to carry me home. I looked over Jordan, and what did I see? Coming for to carry me home. A band of angels coming after me, coming for to carry me home. Swing low, sweet chariot, coming for to carry me home. Swing low, sweet chariot, coming for to carry me home. If you get there before I do, coming for to carry me home. Tell all my friends I'm a coming too, coming for to carry me home. Swing low, sweet chariot, coming for to carry me home. Swing low, sweet chariot, coming for to carry me home.
Thank you, Marilyn. That was beautiful. And a friendly reminder to us all that this is a memorial and we will be discussing death and dying. Our wish is that this is a healing event to support each other after a difficult year and to honor those who have died and to celebrate the work that we get to do together. We all have different ways of expressing grief and healing. There's no one right way. So I trust and respect that you will do what you need to do within this time. So please feel free to turn off your camera or leave if this event is not the right for you at this moment. I also know that we are all busy, and if possible, I encourage you all to take a 5-minute break after this memorial to stretch or go for a walk with a colleague or by yourself, or whatever would be helpful before transitioning back to work. And again, also glad that we're here together today. So I'd now like to introduce David Modersbach, who David has worked with people experiencing homelessness in Alameda County since 1988. He works as a grants manager for Alameda County Healthcare for the Homeless, developing and maintaining healthcare services for people experiencing homelessness. David is part of the National Healthcare for the Homeless Council and a founder of the National Homeless Mortality Working Group. David.
Hi, everybody. It's really nice to join together on National Homeless Persons Memorial Day on the winter solstice, the shortest day of the year, longest night of the year. Across the country, communities across the country are carrying out Homeless Persons Memorial Day events like this. A couple hundred events across the country right now, and that we're all part of. So thanks for joining this. Want to give you all a reminder that our goal is today to mourn the deaths of people experiencing homelessness and learn from those deaths. In 6 months, it'll be the summer solstice, the longest day of the year, sunniest day of the year, when we celebrate the resilience and lives of people experiencing homelessness. So this kind of a yin-yang thing that we're doing. But I'm going to talk a little bit about our homeless mortality review and report that we're working on right now, about 10 minutes. How does a responsible community respect the lives and deaths of its members? We do this by acknowledging, documenting, and learning from the deaths of all of its members, especially those most disadvantaged and vulnerable. That community responsibility really rests with the county, our local government, includes our health department. We must register and learn from every homeless death, both to give value and meaning to every life and death, to work to prevent every preventable death, and to provide solace and peace needed by those who die, and to those who are supporting the people when they die. California counties are headed by 2 types of officials who are tasked with analyzing and determining deaths. These are an office of the medical examiner or a coroner's office. A medical examiner is a county office led by a board-certified physician and staff who investigate deaths, who look at patterns and trends in causes of mortality and deaths countywide. A coroner's office, like ours in Alameda County, is led by an elected official, the sheriff, who appoints a coroner, generally a position without medical qualifications. The coroner's scope is generally limited to investigation of deaths that are either unattended, that happen outside of a hospital or a facility, or that are suspicious in nature. So our county is, our death system is operated by the coroner's office. The next level down is the health department, in our case, the public health department and healthcare services agency, who carry out countywide epidemiology work, analyzing health trends, inequities, monitoring mortality and morbidity. We have great partners here with the CAPE unit. That's Community Assessment Planning and Evaluation in our Alameda County Public Health Department, who do all this and more. Then going down a bit, there's the community of healthcare and services providers like you all who serve people experiencing homelessness. Our community needs information, and we are the ones to learn and put in practice the work to reduce mortality and morbidity. At our own clinic and program level, we also need to review the deaths of people we worked with. This is called mortality review, and it's essential both for our clients and community and for the well-being of our own providers. It's really critical that we all, in our way, in our programs, in our spaces, we begin to carry out regular mortality review processes. Finally, the people who live and die in homelessness, the people who have families, loved ones, friends, and supporters, they need to have the resources to approach death with dignity, to die if possible in peace and security, and to have access to respite care, palliative care, hospice, end-of-life care, and support. Until this year, Alameda County had not carried out a comprehensive homeless mortality report and review process. This year, the Healthcare for the Homeless program partnered with our epidemiology unit, CAPE, to try and accomplish that. We learned that we couldn't count on our coroner's office to provide us with robust data around homeless deaths, which does happen in other neighboring counties. So we got to work doing a new methodology of data matching, comparing names of people we knew that had experienced homelessness through our HMIS system, our homeless management information system, our healthcare for the homeless utilization programs, and utilization records from other partners. And we compared those names of people that we knew were homeless to the statewide death certificate data to get matches of people that were known to have died. We also reached out to our community partners and programs throughout the county who offered names of people who died. And we carefully scoured through thousands of death records, HMIS records, healthcare for the homeless medical records, to identify the names of those who died in homelessness and create our first Alameda County homeless mortality report. That report will be released in the next couple weeks. It will be mainly a data report reviewing homeless deaths that took place between 2018 and 2020. We plan for this report to be carried out annually from here on. We want to see the creation of a community county homeless mortality task force to review that data and make recommendations and implement policy and practice changes to reduce preventable deaths. What we learned from this mortality report is very sobering. We learned that between 2018 and 2020, 809 persons experiencing literal homelessness died in Alameda County. There were 195 deaths in 2018. That increased to 246 in 2019 and to 346 deaths in 2020. Additionally, we learned that because of our data methods, we also learned that during that 3-year period, 250 people who had been recently homeless but were permanently housed within 3 years had passed away during that time. We also identified an additional 599 people who died in those 3 years who had had recent documented experiences of homelessness in the last 3 years, but for whom we couldn't confirm if they were homeless or not when they died, whether they were housed, doubled up, precariously housed, was just unknown to us through this system. Because of our methodology, we uncovered many more deaths than if we had relied solely on a coroner or medical examiner report. Because we also analyzed deaths that occurred in non-suspicious or in attended settings, such as hospitals or nursing facilities. And this will make our county numbers seem higher than other localities who only reported coroner or medical examiner investigated deaths. We'll put the report out soon and people can review the data. But I wanted to cover some of the main points of that we found. How am I doing for time, Aislinn?
2 more minutes.
Okay. Most important point, unintentional drug overdoses are the leading single cause of death among people experiencing homelessness. That's about 25% of homeless deaths. Those 809 deaths over the last 3 years were caused by drug overdoses. This number grew steadily to almost 200 people in 2020 and probably continues to grow. We need to do a lot more close work and look at those overdose deaths, see where and how we can prevent these absolutely preventable deaths. Between 2018 and 2020, about 2/3 of the 809 homeless deaths occurred outside of medical facilities, on the streets, sidewalks, parks, vehicles, shelter encampments, railroads, transit, motels, or other people's residences. 34% of the deaths occurred accompanied in a hospital or nursing facility. Half of homeless deaths were due to acute, chronic, or medical conditions, led by heart and cardiovascular disease, cancer, liver disease, stroke, respiratory disease, and others. Of those acute chronic medical conditions, 40% of those deaths took place unattended or outdoors, outside of hospitals. 77% of homeless deaths occurred among men. Over half of deaths were among African-American population, which is well more than double the general population. Accidental injuries were very frequent, the large majority being pedestrians hit by automobiles, trains, and in transit-related deaths. Homicide was very high, 60 deaths. Suicide, 35 deaths during those 3 years. Basically, we're working right now to do the kind of epidemiology work. We're able, because of our system, to compare homeless deaths with the general population and the rates of deaths with the general population. And that'll probably be part of our report that we get out as those comparisons. Those comparisons are very sobering, around 4 times higher death rate among people experiencing homelessness in Alameda County compared to the general population. And then we're looking at it by cause of death as well. So that report will be released soon. And we look forward to sharing that data with you all. It's going to be a data-focused report. We want to hear from folks as they review that data and help us make those recommendations for policy and procedural changes that can reduce preventable deaths. And we want to see this thing continue to grow year to year. The reporting and our work, especially looking at utilization. How did people die? What was going on with them? Who was touching them? Who was working with them? So we can really get to the bottom of preventing deaths. The one thing we don't want to see grow are the deaths. So together, I think we can work on that and bring it down. That's your homeless mortality report update for now.
Thank you so much, David. And thank you for you and your team doing this really important work. It's critical. I'd now like to invite several of our community providers to say a few words. First is Dr. Jay Reinking, who is a family medicine physician who has been serving people experiencing homelessness in Alameda County since 2014. He's currently the medical director of the Lifelong Trust Clinic and its street medicine program. Welcome, Dr. Jay.
Hi, good morning. I want to thank Alameda County for arranging this and bringing us all together here in this space. I'm going to have to say a few words on this winter solstice of Homeless Persons Memorial Day. It's the longest night of the year, as you all know, but to those who are surviving on the streets, every night seems like the longest night of the year. We used to do night rounds back in 2014, 2015, in the cold, with street medicine, seeing the scurrying of rats as big as cats and fires lit, keep people warm at night. And I think this Remembrance Day brings a lot of folks to mind for each and everybody on the call. For me, it's Kai, who I met one evening around the glow of her fire back in 2014. We talked that night, and then we talked intermittently for 6 months. We bonded over both being born in Hong Kong in the same year, maybe even the same hospital. She loved the peanut butter pudding we used to bring out. And one day she said, Dr. J, I've been knowing you guys for 6 months or so. I've been meaning to ask you something. I feel like I can trust you guys. Can you look at this thing on my breast? And by the time we arrived at a diagnosis, she was already in stage 4 cancer. And Kai really didn't have anybody in the world besides her dog. And when I went to medical school, I didn't think that a big part of my job would be advocating for my patients to have their dogs in hospitals, but sometimes that's what you have to do. And this dog famously shit all over the floor of the 7th floor nurses station. And Highland still kept her and the dog in the hospital. She was housed for 6 months before she passed. She loved her apartment. She died at 34. Her mom was at her bedside. And months later, her mom wrote us a letter. Her mom wrote, I want you all to know how much I am thankful to you. I hadn't seen my daughter in 10 years. Those final months brought us reconciliation. They brought us closure. Knowing that she wasn't alone through that journey means everything to our family. My own uncle died in the early 90s alone in a hospital bed in Chicago from HIV. At that time, amidst the chaos, hysteria of an unknown disease, there were heroic healthcare workers, much like today, who were displaying bravery to be at his side, as there was fear of spread of disease. And that reminds me of the work of each and every person on this call through COVID, showing up amidst risk, walking with the people you serve amidst risk, showing up in fear just because. And at the Trust Clinic, we went to Epping in 2019, as David Modersbach was talking about. And we got a lot of information very suddenly. And over the last 2 years, we've had over 70 deaths of people that we know very personally at Trust. Many of those were recently housed, and people that work in our programs were walking with some of those, or a lot of those individuals. Gandhi once said that the mark of a society is how it serves the least of those in that society. And by that logic, we have a pretty sick society. Yet, we have hope that as all of us together, working together, we give each other strength and we give each other great dignity and accompaniment to staff and patients and clients alike, that nobody should ever die alone. Thank you so much.
Thank you so much, Dr. J. Next, I'd like to introduce Melissa Moore. Melissa has worked with Tiburcio Vasquez Health Center since August 2020 as their street health community health worker for Zone 3. Before coming to TVHC, she was a freelance advocate for Castro Valley, San Leandro, and North Hayward, having had 7 years lived experience on the streets within those areas. Welcome, Melissa.
Thank you, Aislinn, and hello, everybody. Today is a very bittersweet day for many reasons, so I have some words I wrote. Today is the winter solstice, according to our calendar. In our society, it signifies another season. For a homeless person, it signifies a time to prepare for the unforgiving elements in the world they live in. a world that most people never experience. I've experienced both worlds. They have many parallels, yet so profoundly different. As we come together as a community of people who understand in one way or another the struggle that the unhoused face daily, and remember and honor the ones whose journeys ended this year, the unhoused community is also reflecting on the past year and our losses. And with the holiday reminders everywhere, it puts our reality front and center. We grieve in a different way. Our hearts not only hurt, but our spirit is wounded by the losses we have endured yet another year. We get jaded by the injustices, stigma, bias, and inhumanity that we all are faced with daily. We celebrate our lost family members and sit and bring up memories that have us laughing, and that for a brief moment in time we can allow ourselves to feel. I always go back to that camp or to camp during the holidays and spend time with my street family. It is comforting and familiar to me. But it's different now because I'm a service provider and I see the mortality gap between unhoused and housed, and the deaths are rising. I see now that there is a way to close that gap through what we do as a street health outreach team. I personally have lost close to 20 people who I lived with as a tribe during my homeless journey this year alone. People who I called family. This included a father and son within months of each other, best friend in my rock who passed from COVID pneumonia suddenly, another I had known since high school and stood by his side through his cancer battle, the others from pre-existing conditions, diagnosed too late due to lack of medical care, some ODs, some suicides, and some unnatural causes. One name on this list across the country is one name too many. We are the voice as a collective for the country, or for the community we serve. We need to be a loud voice for advocacy to create change, policy reform, equality, education, and accountability. We have gone into the encampments, have gotten to know our unhoused, gained their trust and respect, which is huge. They have changed our views and touched our hearts, and we have done the same for them. Never forget why we do what we do. Please, never forget why we do what we do. We lose some battles, but we also achieve big wins. You are all heroes in my eyes, and in their eyes too. In this season and moving forward, we need to push harder and go the extra mile for change to happen and honor memory of those who have left us this year. They deserve better, and in their memory, we can do better. And I thank you all for hearing me, and God bless you all.
Thank you, Melissa. That was beautiful. I'd next like to introduce Danielle Williams. Danielle Williams is a board-certified family medicine physician at the Roots Community Health Center and medical director for the Street Team Outreach Medical Program, STOMP, that provides street medicine and outreach services primarily within East Oakland. Dr. Williams is a proud graduate of Howard University and the University of California, San Francisco School of Medicine. She's been a physician at Roots since 2017, where she focuses on the care of underserved populations. Dr. Williams?
All right. Can you hear me okay?
Yes, thank you.
Okay. So in the last 2 years, Roots Stomp has served 400 unique patients. And in that time, 43 of those patients have died. 7% of our Stomp population. The leading causes of death were followed by cardiovascular events with 27.5%, and then organ failures with 15%. Ages range from 26 to 77 years old. African Americans represented 50% of the deaths, Caucasian 32%, Latino 12%, and Native American 6%. As the primary medical physician for Roots Stomp, I'm deeply saddened by these passings and truly wish there was more we could have done. Today, let us honor these lives and uplift their spirits. Most importantly, let us keep fighting to house the homeless. I'll never forget a death that occurred this year. This death happened days before the patient was accepted into the Safer Ground hotel. And we found out by looking for them to find them, to let them know that they had finally been accepted. And we had learned that they just passed a couple days prior. Moments like that really resonate with me and fuels my fire to keep fighting for this vulnerable population. I just want to thank Alameda County Healthcare for the Homeless for organizing this memorial. It's very much needed. I feel like we don't acknowledge a lot of these lives. Our days are very busy and we just hear about it and then we just kind of continue to press on. But these lives definitely deserve mention. I just hope everyone has a blessed holiday season and stays safe.
Thank you, Dr. Williams. I'd now like to introduce Dr. Minnie Swift, who is an internist and has taken care of patients at Alameda Health Systems for over 2 decades. Dr. Swift is the Vice President of Population Health of Alameda Health System, has worked with people experiencing homelessness for the past 15 years at Highland Hospital and Eastmont Wellness Center, has been a board member for East Oakland Community Project and medical director of the Alameda County Health Care for the Homeless. Dr. Swift?
Good afternoon. Thank you so much for the invitation to participate in this memorial service. While Highland Hospital is perhaps the most recognized campus within Alameda Health System, we have a comprehensive system of care that includes services for labor or delivery, multiple emergency departments, hospitals, skilled nursing facilities, primary care, and specialty care clinics. As such, our staff and providers have the opportunity to serve patients, people experiencing homelessness in multiple settings, sometimes across a lifetime, sometimes we meet folks at the very end, frequently because people experiencing homelessness don't have the opportunity to pass away in a home setting like others. They are with us during that transition. Recently, because of the pandemic, sometimes our staff are the only ones who are there with them at that time. While we feel grateful to be in this position to serve, to witness their resilience, their strength, their courage, we also know that better is possible. And so we will continue to use their stories as a guide while we strive to improve care and champion justice. Thank you.
Thank you, Dr. Swift. And thank you all for sharing and for the amazing work that you do. Again, my name is Aislinn Bird, psychiatrist with Alameda County Health Care for the Homeless and the Trust Clinic since 2016. And I'm honored to help serve our most vulnerable neighbors. Providing health care to unhoused folks allows me to deeply care for those in need, advocate for those who are marginalized, and is aligned with my values of social justice and faith in humanity. Regardless of our role for caring for our most vulnerable neighbors, whether it's direct patient care for those on the street, front desk staff at a clinic, or administrators performing the behind-the-scenes work, we all do this work from the heart and with love. This is not easy work. And we get to see the best of humanity and the worst. There are many other jobs that we could do that would likely be easier and pay better. And we choose to show up day after day to serve those most in need. It truly is an honor to be with you all today. Thank you. It has not been an easy year for most of us, professionally and personally. The second year into the COVID-19 pandemic, which continues to impact how we work and live, compounded by the worsening climate crisis, increasing disparities between the haves and have-nots, and a more dire housing shortage. Many of our patients have died. And as we know, mostly not from COVID-19, but from the consequences of trauma, poverty, and isolation, factors that our society can change with the will to do so. Many of our patients have died from substance use disorders, either from overdoses or from the long-term health impacts from chronic use. Many of our patients have died from severe chronic medical conditions that took their lives too early due to the trauma of living on the streets. Many of our patients have died young. We know that people who are unhoused have a life expectancy that is 30 years less than those who are housed. 30 years. This directly shows how housing is healthcare. By the time we meet some of our patients, it may be too late to reverse the ravages of poverty, trauma, substance use disorders, and the complications of being unhoused. And we can help them die with dignity, died accompanied with love and respect. We likely all have stories of patients we deeply cared for who died this year. One of those patients for me, SP, died this fall. She was 54, 26 years younger than the average life expectancy of a housed woman in the United States. When I first met SP in 2016 at the Trust Clinic, she was unhoused, living in an abandoned warehouse with no electricity or running water, infested with rats. She was engaged in sex work, had PTSD, schizoaffective disorder, opioid use disorder, meth use disorder. And she was suspicious of our clinic and me at first, which was understandable given her many poor interactions with our medical system, traumatic inpatient psychiatric hospitalizations, and being incarcerated. However, she saw how our whole clinic, from her direct care providers to the front desk staff to the clinic manager, showed her respect and love. We were reliable and consistent, and through that, she was able to build trust and engage in our services. Many in society would have seen an eccentric, loud, homeless woman who was strung out on drugs. But we saw a human being who was doing her best after experiencing severe trauma in childhood, continued to experience trauma, and who was lovable and kind and caring. During her time at Trust, she was connected to long-term case management services, a therapist, moved into her own apartment, which she was very proud of, and was stable on buprenorphine to treat opioid use disorder. She was also very engaged in her medical and psychiatric care. She died in a hospital with a dear friend by her side, and I'm comforted in knowing that she felt the love and care and respect from all of us and got to die with dignity. I'm also comforted by the structures that the Trust Clinic leadership have implemented, especially Rena Brinkstone, helped provide support and healing when one of our patients died. So after one of our patients died, their care team is immediately notified by phone. And within a couple of weeks, there is an optional debrief with their care team to discuss the patient's care, celebrate their life, and provide support for one another. Also at our monthly staff meetings, we read the names of the patients who have died that month and have a moment of silence. These institutionalized, protected spaces to grieve and heal as a team are critical for this work and to prevent burnout. We cannot do this work alone. It takes a team of providers, support staff, administrators, policymakers, and advocates to create the world we want to live in and make sure that every person has their basic human rights and needs met. I find strength and comfort in my team and knowing that so many incredible, smart, dedicated, creative people are doing everything they can to improve the life of others. We won't see the end of homelessness in our lifetime, and we cannot end all the structural racism, violence, and trauma that our patients endure, although we must try. And what we do have control over is how we treat and care for our patients, each other, and ourselves. Love is powerful and radical. We don't often talk about love in the medical field, and it's one of the more impactful tools that we have. We can give our patients a different experience, to look them in the eyes and say, I see you, I respect you, and I want to serve you in the way that is right for you. That is love. And when we love, we can have heartbreak. We are brave to be in this work. Again, I'm deeply honored to be here with you all. And I'd like to end with some words from Maya Angelou, who said, "I've learned that people will forget what you said. People will forget what you did, but people will never forget how you made them feel." Thank you. I'm now very honored to introduce Bishop Yvette Flunder, a San Francisco native who has served her call through Ministry for Justice for over 30 years. She's currently the senior pastor and founder of City of Refuge UCC and presiding prelate of the Fellowship of Affirming Ministries. Bishop Flunder.
Greetings, everyone, and what a wonderful blessing it is to be in the company of angels, people who provide the services for this unusual and difficult time that we are in. And I can say, after 30 years of work in HIV and AIDS, perhaps in some ways, my mind and heart was prepared to put a hand on and a heart in to the work surrounding our housing insecure and homeless people. We are kin. City of Refuge is strategically placed right across the street from the hotels that have been a part of providing housing for people living right now in a homeless and housing insecure position, right down the street from the FEMA trailers and right down the street from the tiny home community for young people. And so this is a very active part of what we do. And we do it for the same reason that we felt motivated 30 years ago to touch people who were living with HIV when other people would not touch them. We do it because we believe it is our human responsibility and it is our spiritual privilege to be called to heal. I'm of the opinion that people who are called to heal, like so many of you whose faces that I am looking at today and whose hearts I see through your eyes, I am of the opinion that people who are called to heal are angels on assignment, on working visas. How's that? Doing the work of healing and doing the work of comfort. I've also learned that working with people who are homeless and housing insecure has left me to believe that if the human family has a major weather or planet crisis, the community who we call homeless will probably be the most capable of surviving a crisis than the folks who still don't know when you flush your toilet, where does it go? And I have to say, I applaud the incredible capability for homesteading, the incredible capability for creating community on corners, the incredible capability of loyalty that I have seen among folks who are housing insecure and homeless in and around our communities. And so I will say to you that I believe it is our responsibility, privilege, and call to serve in what is an epidemic of homelessness. I believe it is our responsibility to provide physical and spiritual as desired support to those in need. We do have a duty to feed the hungry and care for the poor, a responsibility to provide shelter. We have a duty to clothe people who are naked and people who are sick. And I like to quote from Matthew 25, where it says, Jesus said, "For I was hungry and you gave me food. I was thirsty and you gave me to drink. I was a stranger and you took me in. I was naked and you clothed me. I was sick and you visited me. I was in prison and you came to me." And his disciples said, "So when exactly did all of this happen to you?" And his response was, if you'll do this for the least of these, my little ones, you will have done it for me. Whatever may be your understanding, presence or absence of understanding or desire to connect with the divine, I can say to you that the divine is in one word. God is love. God does not just do love. God is love. I believe in the presence of the divine. I believe that when we touch people, we embody the divine love. When we help people, when we heal people, when we serve people, we embody the divine love. And if I were to make any criticism about a lot of the religious thought and religious ideas and religious politics that we're in right now, I would say that a lot of my colleagues are much more focused on the politics of religion, and not enough are focused on the heart of religion. To do justice, to love mercy, and to walk humbly, I believe is what the divine calls for. So I will leave you with this thought and prayer today. Gracious Divine One, we gather today to mourn those who have died. We pray today for the homeless women, men, and children and siblings, some known to us, some known only to you. May they find eternal home and peace with you. We pray that you would give them rest, complete joy, shalom, in your presence, in your mercy, by all of your names and manifestations. Hear our prayer today. We gather to comfort one another because this is hard work. We are saying and remembering goodbyes to friends, family, and neighbors. We are saddened by our loss. Sometimes we wonder how it is that your grace, oh God, has kept us alive. But we look to you because we believe we still live because we are here on assignment. And so, great God, dry our tears and give us hope. In your mercy, hear our prayer. Holy One, even in our sadness, we give you thanks. We give you thanks for the blessings of the brothers and sisters that we have engaged with and that we remember today. We praise you for the good works you have done in them and through them, and we celebrate every good gift that they gave us, even when they thought they had nothing to give. They changed us and shifted our conscience. We praise you for workers and volunteers, for medical professionals, for people who are involved in the work, statisticians, those who are gathering information, those that are designing pharmaceuticals. We thank you for every person who is a blessing to the persons who are without homes, be they social workers, police persons, politicians, cooks, and simply friends and surrogate family. And in your mercy, hear our prayer. And finally, this God of justice. We gather to stand together against poverty, against policies, against illness and war that causes and exacerbates homelessness. Homelessness all over the world has manifested and magnified because we are putting the attention often where the attention ought not lie. You have made it clear to us through our consciences and through all Holy Writ that it is not your desire that this happen to humanity. And we look for the day when homelessness will end. The day when our swords are beaten into plowshares and we study war no more. We look forward to the day when all are healed, all are housed, all are helped, when there are no poor among us. We prepare for the day to look forward in hope, but we offer ourselves in the process of service to give to those who we have the opportunity to give to. Help us create the world that you desire. Help us, and may we all, regardless to the faith we possess or profess or do not possess or profess, because when we do good, we do the good of God. We ask you, in whatever ways we pray and hope, whatever eyes we see through when we see those who are sick among us, we ask you, help our homeless siblings. Help them through us and give us miracle opportunities to do even more than what we have done. We seek your redemption and your justice and your grace and your mercy if we have failed to be helpers, and motivate us now to get in the struggle with those who suffer. Help us and help more people than us to hear this call today. In your mercy, in all of your names, you who are just, right, kind, loving, and divine, hear us today. Amen. ACHCH. And so it is. God bless you, my beloved.
Amen.
Thank you so much for your words of wisdom, Bishop Flunder. I'd now like to close with our last speaker, Lawrence Lincoln. Lawrence is a writer and advocate for people with no place to be somebody. He lived on the streets of Oakland for 5 years. Now he lives indoors, goes to school at San Francisco State University, and is dedicated to finding ways to live beyond homelessness for himself and everyone who is still out there. Lawrence?
Thank you, Dr. Bird. Yeah, in my time out on the streets, I lost to date more than 12 people, none of them from COVID, all from the violence that attends poverty, be it overdose or, but you know, they're gone. And, but I'm not, I'm here. And it's, you know, and I wouldn't have been, you know, I would have been a non-preventable death were it not for working with Trust Clinic, Healthcare for the Homeless, Dr. Bird, Dr. J, Wilma, all here, all people I love. And those people who are not here, who I love, like every day, I live with intention because I'm what's left of them, you know? And I want you all to know, all you healthcare providers, all you program administrators, all you people who have your heart in it with us, you know, it's a war zone. And you teach us how to practice self-care and to live fully in the days that we have, you know, so this is the darkest night of the year, but it gets lighter from here on out. Each day gets longer. And, you know, I need you guys to, as you need us, to take care of yourself, to look after yourself like you look after us, because you're so very important. I wouldn't be alive. I am a living testament to the work that you do. And it's no joke, you know, that you guys who know me know that. And I live with all intention and all gratitude and all hope. It's a hard situation. This homeless thing, you know, it's unjust. But what is just is the humanity and love that is shown in this struggle. And I just want to thank you. And I want you to know that, you know, come summer solstice, we'll be here, you know, and we'll be more here. And because of your love and because of work like this, because of what we're doing here right now, there's hope. And the people we've lost weren't lost in vain. They were lost so that we know more how to prevent those losses, and we know more how to be here and be resilient. So I just thank you. I love you. And I just want to invite everybody back for June 21st, when we, instead of mourning the losses, we celebrate the resilience of, you know, of you all and the people like myself who, you know, who are alive because of what you all did. So Thank you from the bottom of my heart.
Thank you, Lawrence. Beautifully said. I'd now like to close with a moment of silence, and then we'll end that moment of silence with a bell. And thank you all for being here. So, a moment of silence. Thank you again for being here and for all of your amazing work. I hope everyone takes such good care of themselves and each other. And like Lauren said, we'll see you on the summer solstice to celebrate the strength and resiliency of people experiencing homelessness. Thank you all.